Watch me for a second. If I take two vertebrae and I sit them on top of one another, there is a hole that you can see only when two vertebrae come together. Right here on the side. Those holes are above have a pedicle from the vertebrae above, and below is the pedicle from the vertebrae below. Actually, let me show you on the spine here. I'll let you look in a second. If you take a look, here's like a pedicle. Here's a pedicle. Right in between is a hole that you can see when two vertebrae are stacked up. What are these yellow things here? Anybody have an idea? Those are nerves, right? They're actually spinal nerves. They come out of these holes. This hole is called the intervertebral foramen. This allows the spinal nerves to come out. So the reason I'm pointing it out is this. Take a look at your pedicle from the side, like a side view like this. And again, the models are a little bit different. See if you see a little notch in the bottom of the pedicle and the top of the pedicle. That notch helps to make that hole a little bit bigger, a little bit wider. Let me show you right up over here. So here's a pedicle of one vertebrae. Here's a pedicle of another vertebrae. See this little notch right here? And then there's a notch in this one here. Again, going around, they're all a little bit different. But see if you can see the notch in the pedicle. Those are called the vertebral notches. And what they do is they make the hole where the spinal nerve comes out bigger. It makes it wider so it has more room. Okay? So those would be called the vertebral notch. I'll let you see if you can find them real quick. And the way you're going to see it is go to the side of the pedicle. And again, on mine here, I got a good one on the bottom. The one on the top isn't that great. Yeah, that's a good one. That's there. And then it's a little bit up here, but it's not as much. But it's better on the bottom. Yep, that's your vertebral notch right there. And again, it makes that hole a little bit bigger. Okay, nice.
And then up here.
That's good.
Where?
Right here.
notch. The corner or a little hole?
It's like they scraped off a little bit more, so it got room. And then he said there was one up here, a little bit.
To this day, they don't let us vote.
Should be right here. So underneath the wing.
So that hole on the side I have in your notes is called the intervertebral foramen. And guess what? I will let you abbreviate it on the test because I will ask you about it. IVF. Intervertebral foramen. What does inter mean?
Inside.
Between.
Oh, sorry.
Between. That's okay. Vertebrae. What's a foramen? A hole. Right, so you can put down IVF. As long as you know it's intervertebral foramen and not in vitro fertilization. As long as you know it's not that, right? It's going to be intervertebral foramen. That's it right there, yeah?
We can put IVF and that's
Yes.
okay.
You get the full credit. Okay. All right, so again, just one more time, guys. Just want to make sure this, and once we get through this first part, the rest will be a little bit easier. So again, the body, sticking backwards are your two pedicles. Here is going to be your two lamina. This whole thing in my notes, if you're taking a look at my notes, number 2, I call this the neural arch. Okay, that includes the pedicles and the lamina. In your book, this part here where the two laminas come around, they call that the vertebral arch. I didn't put that in my notes. I didn't learn it that way. I learned it a little bit different, where this is the neural arch. So for me, know that the neural arch, which I have in your notes, consists of the pedicles and the lamina. So now, they form this hole right here. Again, one more time. What's in this hole? The spinal
Cord.
Very good. So this hole we have a name for. We call it the vertebral foramen. Right? That's where the spinal cord is. If I asked you on a test, what's in the vertebral foramen, you're gonna say spinal cord. If I ask you on a test, what's in the intervertebral foramen, what's that answer gonna be? Spinal nerves, right? You can't use them interchangeably. They're two different structures. The nerves come off of the cord. So the vertebral foramen up there houses the spinal cord. The intervertebral foramen, where my fingers are here, house the spinal nerves. And we're going to look at those structures as we go on in the semester in a couple of weeks. Okay? All right. So on one vertebrae, we call this the vertebral foramen, where my stick is in here, this hole. But if I stack a couple vertebrae on top of one another, and we get a whole bunch of foramen in a line, then we call that the vertebral canal or the spinal canal. On one vertebrae, you're going to call it vertebral foramen. On a bunch of vertebrae stacked together, it forms like a whole canal that the spinal cord sits in. You're going to call it the spinal canal. Okay? Anybody lost on that? Any confusion as far as the intervertebral foramen versus the vertebral foramen?
Could you just show me where the inter...
Yep, and again, the intervertebral foramen you can only see when we stack two vertebrae up. That's the hole on the side. One vertebrae alone, you're not going to be able to pick it up. You got to stack two together. So probably the easiest place to see it are all these intervertebral foramen here. Those are all holes for the, we're going to learn there's 31 spinal nerves that come off the spinal cord, right? These are those. They all come out of those intervertebral foramen, or most of them come out of those. Okay. Beautiful. Number 4. So you'll see, again, if you hold your vertebrae this way one more time, you'll see there's a bunch of other things that are sticking off the vertebrae. Let's take a look at them. We're going to call those processes. So watch this, guys. If you hold your vertebrae like this, the two processes coming off to the side like this, they're coming off sideways, these are the transverse processes. Transverse processes. What does transverse mean? Something goes sideways or across. Very good. So you notice they're going sideways. If you hold the vertebrae the regular way, you'll see them coming across. So those are your transverse processes. I'm not going to come around and check you on that. That I'm pretty sure you'll be able to find. Now, where the two lamina come together, there and there's a piece of bone sticking backwards. These were the transverse processes. This one's sticking back. Come off your lamina and look backwards. That is the spinous process. Spinous process. These are posterior. Make an association. Take your fingers for a second and just touch the back of your neck, like right here, because they're real prominent. Feel those bumps? Those are your spinous processes. Okay? Look at this guy. If we take the spine here, all these bumps sticking back all the way down, all spinous processes. Sometimes you can see them on people if they're like really thin, like a little kid, like a little boy that's like 4 or 5 years old. They don't have a lot of muscle mass, and you look at their spine, you can see every one of the bumps almost on them. A little boy or a girl, that type of thing. Those are all spinous processes, right? You can even feel them, but sometimes you don't even have to touch them. You can just visualize them. So all these bumps are the spinous processes. They stick out backwards, okay, in the back. Okay, 2 transverse processes, 1 spinous process. Now, take a look at your vertebrae, kind of hold it the regular way, this way. Look for 2 things that stick up like ears, like cat ears. Kind of remind me of a cat type of thing. These 2 things sticking up right here. Those are the superior articulating processes. Superior means what? On top. Good. Here's a word I'm going to use a lot the rest of the semester. What does articulating mean? When 2 bones, anybody, join together, right? They join together. So this is where two bones are actually going to join together, and a process is just a thing sticking up. So does anybody see that? Anybody not be able to find the two like little cat ears sticking up? Just, yep, those are good. But that's the bottom ones. That's like this. See it?
Cat.
No, it's right there. Yeah. They stick right up. Let me see, guys. Good. Good. You got it. You got it. So
This one? Yeah.
Yeah, it's just upside down.
Ah.
Use this vertebrae here. See them sticking up?
Ah, okay.
Yep.
now, watch this. Depending on your vertebrae, on the underside of the lamina, see if you can find the two inferior articulating processes. They're probably on the underside of the lamina. See if you can find the inferior articulating processes. Right, so the superior would be the ear sticking up. These are a little bit harder to see. You got it. You got it in reverse. That's it. Perfect. Perfect. Where we almost. Perfect. Right there. Where we always look fused. It does. It's like that part. It's coming off, so it's kind of fused. Is that what you're asking me? Yep. You got it right there. Yeah, that's it. Yep. Just make sure these are important. Yep. You got it. Beautiful. Right there. You got 8 points. All right. Nice. That's perfect. So guys, watch this. Let's take this vertebrae here, and I'm going to join it with this vertebrae that's going to go on top. So check this out. The superior articulating processes of one vertebrae are going to articulate with the inferior processes of the vertebrae above. And that's actually going to form a joint. So these superior articulating processes, again, they kind of look like the ears of the cat sticking up. They articulate with the inferior articulating processes of another vertebrae. So they join together like that. What's between the two bodies where I have that space? What's going to be sitting in that space there between
Nerves.
the two bodies?
The disc.
That disc, right? The
disc.
intervertebral disc. Very good. So you have that, and then the spaces, I'm sorry, the joints in the back of the vertebrae. Now, last thing. On the processes, all 4 of them, the superior articulating and the inferior articulating, if you feel there's a flat area, the process is the whole thing sticking up, but check this out, just kind of feel, you'll feel like a flat area on the process. That is called a facet. I have it written down for you, it's F-A-C-E-T. And here's what the deal is with this. And I can't reach quite that high, but check this out. This whole thing here is the process. But see the flat area on it? It actually has cartilage on it. That flat area on the piece sticking up is the facet. A facet, we're going to see as we go through the semester, is a flat joint. All right, so that's just this flat part on the process. Does anybody feel that? Everybody does anybody not feel it? This one I have to come around and check you, I don't think. Just a flat part on that thing sticking up. That is known as the facet. Okay? And there's usually a little piece of hyaline cartilage on there. Do you ever hear like your neck make a popping sound or a cracking sound or whatever? That's the joint when they move that causes that little cracking type of sound in there. So if you hear like a little click or a pop, things kind of realigning themselves, that's the joint that's making that noise, okay? So again, here's a picture. These are all in your lab book. Here's the inferior articulating process of one vertebrae articulating with the superior of the vertebrae below. Here it is on a side view. Inferior of one vertebrae articulating with the superior of the vertebrae below. So these are really where the backs of the vertebrae, the posterior portions of the vertebrae are articulating together. Okay? So we call them articulating processes. Each process has a flat area. What's it called? Facet. 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 That's perfect. Perfect. Okay? So if you are familiar with this, you know most of the anatomy of the vertebrae. We just did a whole bunch of them at once because a lot of them have these similar features. So now what I want to do is let's go through each region. What do we call the neck vertebrae?
Cervical.
How many are there? 7. And is a primary or secondary curve? Secondary. We're going to go secondary. Cervical one developed after birth. Excellent. So do this, guys. On your ring, pick up the vertebrae now. That is the smallest vertebrae. And we're on page 2. Is there anybody have any questions on page 1? We're good? Okay, so we're on page 2. So look at the notes for a second. A couple things I want you to highlight, or at least mark, put a star next to them. These are the features that I want you to find on the cervical vertebrae. You know most of them. I'm just going to add a couple minor things. Check this out. The body. When you look at the body of the vertebrae, you're going to notice, compared to the vertebrae we just did, the body is going to be small. Think about it. The only thing the neck is carrying is the head. The head maybe weighs about 10 pounds, so it's not a lot of weight. So the body of the vertebrae can be, I have a good cervical vertebrae here. The body you're going to see is small. So highlight that, because I'll tell you why. On the next exam, there will be a station where a vertebrae is sitting all by itself, and you got to tell me what part of the spine does it come from. So what I'm showing you now is the features of a cervical vertebrae, so you can kind of figure out, geez, is he asking me to identify a cervical vertebrae, a thoracic vertebrae, or a lumbar vertebrae? It's really easy. So highlight a small body. The pedicles are normal. You see the pedicle coming back. They're a little bit coming to the side, so you'll be able to find the 2 pedicles. No problem there. Nothing to highlight there. That's normal. The lamina here and here, those are normal. There's nothing to highlight. Those are pretty good. Letter D, highlight. The vertebral foramen is large. So if you remember, this was the vertebral foramen. Look how big it is. The reason for that, the spinal cord, when it comes out from the brain, is wide in diameter. So the wide spinal cord has to fit in this hole right here. So it's got a large vertebral foramen. Okay, large vertebral foramen. So that's a big thing you want to look at. Small body, large vertebral foramen. The next one, highlight that. This is a big one. The transverse process, if you notice, comes off to the side. This is the transverse process, but take a look at it. It has a hole in it. That hole is called the transverse foramen, right? So it's telling you it's a hole in the transverse process. And guess what? We only see these in the cervical vertebrae. No other vertebrae have a transverse foramen. So if you're taking a test with me, and I have this vertebrae laying at your desk, you say to yourself, hey, you know what? Small body, large vertebral foramen, transverse foramen, these are only in the cervical spine. I would bet my house, my car, my kids, my dog, everybody I would bet that's a cervical vertebrae, and you're going to get it right, okay? Because those are just features that are unique to the cervical spine. So, what's in that transverse foramen? Not nerves, not the spinal cord, not spinal nerves, however, blood vessels. Take a look up over here for a second. For those of you going on to Anatomy-2 in the springtime, let's say, or sometime in the future, we're going to see that in the transverse foramen, so all these are the transverse processes, they have holes in it. You see that red line, that red thing going up there? That is a blood vessel that's going up on both sides that go into the foramen magnum, that big hole in the occiput, and it feeds the back of our brain blood. So these 2 blood vessels are called the vertebral arteries, and they travel in this hole this way, right? They're going up, say the brain is over here, they're traveling up and sending blood to the brain. Notice these vertebral arteries are only in the neck. Do you see them in the thoracic spine? Negative. You see them in the lumbar spine? Nope. Only in the cervical spine. So that would clue you in that this is a cervical vertebrae. All right, so this is the transverse process. That is the transverse foramen, only in the cervical spine. All right, there's no reason you should get that wrong if you see that on a test. Letter F, highlight. Here's another thing unique to the cervical spine. It has a spinous process in the cervical spine, but take a look at this one up here. Here's a good one, guys. See at the end of the spinous process, it splits. It has like a little division there, like a fork in the road, so to speak. We call that a bifid spinous process. A bifid spinous process. I see a couple of you have cervical vertebrae where it's actually broken. Sometimes they break off, but if you take a look at my vertebrae up here, see the that little split right there? That's only in the cervical spine. That is a bifid spinous. And you have a lower.
Looking at the wrong one.
Yeah, it's just like, I don't see it.
You're looking at the wrong one.
This is the smallest one.
What do you see, bro? I don't. It's broken.
Yeah.
It's just one look.
Yeah, yours was busted off. Okay. So that's a bifid spinous process. Again, guys, no other vertebrae have that. None thoracic vertebrae don't have that. The lumbar vertebrae don't have it. Only in the cervical spine. Yeah, yours is busted off a little bit. Okay. So those are the features. If you look at the vertebrae and you see them, you're going to say to yourself, wow, you know what? That's a cervical vertebrae, and you get that question right. That's a station right there. Okay? Now, take a look at the second part here. I have something called atypical cervical vertebrae. So that means the 7 cervical vertebrae, not all of them fit the pattern that I have up there on the PowerPoint. We're going to see that 3 of them are different. Okay, 3 of them are going to be different. We're going to see C1 is different, C2 is different, and C7 is different. When a vertebrae is different, we say they are atypical. All right, so C1, C2, and 7. That makes 3, 4, 5, and 6 typical. 1, 2, and 7 atypical. So let's take a look at the atypical vertebrae. If you can, guys, in your box, there's only one. Take the ring out with the 2 vertebrae on it. You should have a ring with that. I think we took that. It should have 2 vertebrae. Beautiful. Beautiful. Okay. So let me get your attention up here, just as an overview, then I'll go through the notes with you. Watch this. Let's do 1 and 2, just as a general thing so you can see. You're going to see that C1, which is this vertebrae here, looks like a ring. Okay? C2 is this vertebrae here, and it looks like a regular vertebrae, but watch this. On the body, there's a thing sticking up, kind of like a thumb, kind of sticking up like a hitchhiker would have his thumb up like that. That thing is going to receive the ring over here, and watch this, the ring, C1, sits on C2, and it allows the vertebrae to do this, to rotate, so that you say, no, I don't want to leave class at 11 o'clock, or whatever time we're here till, right? Where we go, no. The ring pivots on this little post over here. This little post is called the dens, right? It's going to be on C2. So the ring of C1 pivots on the dens of C2. Here's a picture from your book, guys. Check this out for a sec. Oh my God. So this here is the ring. This is the C1 vertebrae that we call the atlas. And then here, this post that sticks up, that thumb-like thing. This is the dens that's on C2, and now the atlas will pivot like this on C1. All right, and that allows this motion where we go, no. Okay? It allows us to rotate. So let's take a look at the features of C1. The other name you can use for C1, although C1 is an easy name, you could call it the atlas. All right, so C1 is commonly known as the atlas, or you could say C1. Okay, so here's the landmarks that I want you to know. If you hold up the atlas, and if you don't have one, you can watch me up over here. This is the whole ring, right? This whole thing is the ring. I'm going to go a little bit out of order from your notes. I'm going to do the second thing first. This backbone right here that swings around, this is an arch. This is called the posterior arch. So this thing right here is the posterior arch. This little ring right here that makes up the ring, this is the anterior arch. So you're going to see the anterior arch is smaller than the posterior arch. So this helps you to kind of figure out front and back. The anterior arch is a smaller arch. The posterior arch is the larger arch. Now, notice one of the reasons this thing is atypical, it doesn't have a body, right? Wasn't the body always in the front, like right here? There's no body. So we still have to carry the weight of the head. So check this out. If you took your thumb and your forefinger and you put it together here, that chunk of bone between my thumb and forefinger is called the lateral mass. So it's on this side, and then there's a lateral mass over here. So all this bone between your thumb and your forefinger, that's the lateral mass. That carries the weight of the head. Let's go right here. So watch this. Yep, that whole piece of bone there, everything between your thumb and forefinger, everything in that whole chunk of bone. So watch what happens, guys. Our occiput, if you remember from last week, these two things were the occipital condyles. They're going to sit right on the lateral masses on the top. And watch what this one allows. This one allows the motion of nodding. Yes, I love anatomy at 8 o'clock in the morning. Nothing better to do, right? Yes. Okay. So that lateral mass is actually going to be the attachment point of our skull. That's how your head is going to sit on that first vertebrae. Okay. So just to review, what's the big ring in the back, the big arch? Posterior arch. The smaller arch in the front? Anterior. What's the chunk of bone between my fingers? Lateral mass is perfect. The vertebral foramen is typical, right? There's nothing atypical about that, but look how big it is, right? The spinal cord, again, at this level is quite large, so it's going to have a big vertebral foramen. So that you're going to see, that's no problem. The transverse processes, they're typical. They're going to stick out. What's the hole in the transverse process again? Transverse foramen. Again, what's in that? Arteries, right? Blood vessels that go to the brain, right? We'll actually call the vertebral arteries. So that you're going to see that normally, the transverse process with the transverse foramen. The next thing is a little bit weird. That anterior arch is going to articulate, again, that means to join with the dens of the axis of C2. So watch this for a second. If I take that anterior arch and I sit it on the dens over here, there's a facet, which is a what joint? What kind of joint? What shape? Flat. Excellent. There is a flat joint on the inside of the anterior arch. If you took your finger on the anterior arch right here, you're going to feel it's flat. That flat surface receives the front of the dens, and we call that the facet for the dens. That's my, right here. Articular facet for the dens. That's the next thing I have in your notes. It's a flat surface on the inside of the anterior arch. Okay? Again, sometimes you can't see it, although I can, but you can feel it definitely. Right? If you put your finger on the inside of the anterior arch, it's going to be flat. That's the facet for the dens. Okay? Any questions on that, guys?
Professor, the lateral masses, you said attachment.
The lateral masses are just
But you said attachment from what?
a couple things. One thing is that it actually is where the head is going to sit. So the head's going to sit up top here, and then also it's going to sit on our second cervical vertebrae too. So here's the lateral mass on the bottom. See how it sits on the second cervical vertebrae? Now the head is going to sit on top. So it's in between the head and C2. That's where the lateral masses are. So all I said so far was for attachment of the head. We're going to add to that. Okay? Anybody else questions or comments? Okay. Last two things. On the top of the lateral mass, you're going to see a little bit of a cup. This is the superior articulating process. Right here, guys. Again, a nice picture in your book. This whole cup right here, that's the superior articulating process. That's going to receive our, here we go, occipital condyles that we did last week. Remember these two condyles? They're going to sit just like that. And again, the motion you should know here is nodding, like yes. Okay? That allows for that kind of nodding. So the occipital condyles sit right in there and there. And that motion is going to be, yes, I understand what you're saying. What was it called? The superior articulating process. Superior articulating process. What are we on? Number 7 of your notes. What do you think the bottom articulating process is going to be called? Inferior articulating process, and that's going to sit on C2. So this is the part that's going to sit on the second cervical vertebrae. That's the lower part of the lateral mass. Okay? So, and just to differentiate, the inferior articulating process is more flat. The superior one is more cup shaped. It's got more of a cup shape to it. That's how I usually tell the difference between the top and the bottom. Right? The superior is cup shaped. The bottom one is going to be a little bit flatter. Okay? So those are the landmarks of the atlas I want you to find. I'll give you a couple minutes. In a couple minutes, I'll give you some time to go through this and digest it because I know it's a lot. Notice though, does the atlas have a spinous process sticking off the back? Negative, no spinous process. So that's one of the things that's also kind of unique. It doesn't have a body, it doesn't have a spinous process, it doesn't have pedicles, it doesn't have lamina. Instead, it has these arches. So you can see it's very different. That's why we say it is atypical. Atypical. Okay? That's your atlas. That's one of the harder ones of the day. Okay? C2. You can also call C2 the axis. So you can say either the atlas or the axis. Whatever you, the atlas was C1. You can say C2 or the axis. I'm sorry about that. C2 or the axis. So watch this. Let's skip everything. Let's skip, let me follow your notes. Let's skip 1 and 1A. From 2 down, the pedicles, all the way down to the bottom, this is all typical. You should be able to find all of these things on C2. You should find the pedicles, the lamina, the vertebrae is typical. You're going to find the transverse process with the transverse foramen. No problem there. It's going to have a bifid spinous. All that stuff is normal. What I want you to highlight is number 1 and 1A. That's what's different. The axis is the only vertebrae. The axis is the only vertebrae to have this post sticking up off of the body. That post is known as the dens, D-E-N-S. I also put in parentheses there, odontoid process. When I was in school, that's the way we termed it. So you may hear me say that every once in a while just because that was programmed that way. But you can say the dens because it's easier to say the dens than it is odontoid. But just realize if I do say odontoid, that's what I'm talking about. It's the dens. Okay? That's what's unique to the C2 vertebrae is the dens. Guaranteed, guys, these will be either 1 or 2 stations on your test coming up. Okay? identifying these bones and knowing the parts. So I would be able to master these two. Okay? Atlas, C1, Axis, C2. And guaranteed station on the test. Guaranteed. The last cervical vertebrae that's atypical, we said, was C7. So watch this. The best way to teach this, I've learned, is looking up here. Take a look. Here's the 7 vertebrae. Here's C1, C2, C3, C4, C5, C6, C7. Take a look at the spinous processes from my thumb up. See how they're all smaller? Even the spinous process on C1, there isn't. All the spinous processes are small, but look at the C7 spinous process. See how it sticks out more than the ones above it? So they call this C7 the vertebrae prominens, meaning it has a prominent spinous process. The spinous process is long, it's slender, it's got a little bit of a bump at the end of it right here. They call it tubercle. So that's what makes C7 unique. It has a long, slender spinous, okay? So you can call it C7. Most of us call it C7, but they also refer to it as the vertebrae prominens. Questions or comments? So let me do this. Let me let you sit with this. Make sure that you can identify all the features of a typical vertebrae. That was the middle-sized vertebrae. A cervical vertebrae, which you have, the atlas and the axis. Make sure you're comfortable with that. I'll come around and help you. Then we'll look at the thoracic vertebrae, which you're going to see are pretty easy. The only thing the thoracic vertebrae that I have to teach you is our ribs attached to the thoracic vertebrae. So there's got to be a mechanism to hold the rib to the thoracic vertebrae. That's what's going to be different. All right, we'll do that in a couple minutes. So start working with this, take your pictures. One other thing, guys, I just want to point out, it's funny, this semester we switched over to this atlas. Did you guys get this with your package? It's funny, I looked at it, I was a big proponent of this atlas when we reviewed it back last year. So when I got it, I looked at it, I go, well, this is a wonderful book. I put it on my bookshelf, and I kind of forgot about it. And I just want to remind you, not that I want you to study just from the pictures. We were just talking before class. The students that do well on this next test, it's not a hard test, it's just a lot of information. The students that do well are the ones that look at the bone, touch the bone, you can kiss the bone, whatever you gotta do to make an association, I don't care. Those are the people that do well. The people that just look at the book, not that you can't pass, they don't do as well. I just observe students. I think it's just just an interesting thing to see how people study, and I watch who succeeds and who doesn't. And I'm telling you, the way to succeed is to touch the bones. But this book is the closest thing compared to even your lab manual as far as the detail and being able to see the landmarks. So I just want to remind you, if you stuck this thing on your shelf, they do a great job, even the histology slide. But what we did today, I'll just show you real quick. All the vertebrae are there with great detail. So this is another thing you can use when you don't have the bone in front of you. But the best thing is to really be able to identify the bone landmarks by touching it, because that's the way I'm going to test you. Okay, it'd be different if I was testing you on a diagram, then I would say study the diagrams. I will not do that. There will be bones there. So go. It's your time to look at this. In a little while, we'll do the thoracic and the lumbar. Wait, just real quick. Attendance. Did we get the attendance around? Did everybody get it? You guys get in the front? Just grab it real quick. Yes, these. Look, you got real bone. You know it's lighter,
And it actually chips apart when you drop it. So all these are real bone. Yep. That's a real bone too, yeah. Compared to these, yeah, it's more porous, right? These are plastic. These are plastic. So we've got the real bone right there. Yeah, you can touch a real person.
Let me see that.
Good.
Yeah, it feels. Yeah. This is plastic, yeah. Yeah. This is real, bro.
What?
Yeah, this is real. And this is plastic. Feel it. Yeah, bro.
You know what he said? He said these are real.
Yeah, it's all.
Real.
This is real. Yeah. Professor,
No, they actually feel real too.
is this bones real?
Something. Yep, that's a real bone. You know how you can tell? See how light it is? Because over time it gets lighter, and then all the little holes. That's where like blood vessels go in and things like that. So yeah, this is all real bone.
How did they get it so clean?
They have to like spray it.
Yeah, there's actually chemicals that use to take all the fascia off and stuff like that. Isn't that wild? Yeah. But you know, over time too, if you just let the skeleton out,
Real?
if you left the skeleton out on the in the ground, eventually it would become like that bacteria.
Yeah.